In a bid to alleviate the financial and physical pain associated with healthcare expenses, the federal government has reiterated its commitment to achieving universal health coverage for all Nigerians. During a ministerial press briefing on Thursday to mark Universal Health Coverage Day, Professor Mohammed Ali Pate, Coordinating Minister for Health and Social Welfare, highlighted key government initiatives aimed at improving healthcare access and reducing out-of-pocket spending. The event, held under the theme Health Under House Government, showcased the government's progress in expanding healthcare coverage through various schemes.
Pay for a bicycle and want to ride a Mercedes. So if you want a good healthcare system, it has to be properly funded. And as we move towards UHC, I urge the non-state actors, the civil society organizations, our development partners, and all others to advocate to state governments, to local governments, to our parliamentarians, because I know for a fact that our president last year announced that health is back on the front burner. It's one of his key priorities as part of the human capital pillar of his renewed hope agenda. So it doesn't need more convincing. He's already increased the allocations for health, and I'm sure he will continue to do that. But all of us have to really be in that mindset that we should invest. So I would say that we celebrate this with a sense of fulfillment, that the last year's hard work by all of you, all my colleagues here in the ministry, all the health workers all over Nigeria, our professional unions, is beginning to pay off, but we're not yet there, and we need to continue in that spirit to achieve the objectives that we have set for Nigeria's health sector. I want to thank you all, and I want to ask if my colleague also would like to say a few words before we wrap. Okay.
To encourage all of us not to rest on our horse. The momentum and the increased funding that is coming into the sector. So it now behoves on all of us as health workers, as stakeholders within the health system, to ensure that we continue to move strongly and frontally forward. The other aspect of it that I also like to add is particularly for the journalists. The average Nigerian must also be continually educated that we need to save for ill health. People believe culturally that when you save for ill health, you are inviting ill health. That is not correct. So we need to continue to educate the people that just like you save to repair your car, to service your car, you must also ensure that you save for your health. And that is what the health insurance and the essence of universal health coverage is all about. This is one message I believe you need to help us take to all Nigerians so that we all see that we as individuals, as government, need to invest to ensure we have universal health coverage in Nigeria. Thank you.
I will be taking 2 questions. Kindly, the question is next.
Good morning, ladies and gentlemen. I want to ask everybody is been done to your primary health care centers across have been upgraded in the last 1 year.
My name is Fatima Sir. Sir, please, we still want to know how far you document combat as the grassroots being covered in universal healthcare.
The grassroots?
Yes, sir.
Already been upgraded to functional level 2. Sorry. In the last 1 year, 238 facilities have been upgraded to functional level 2. An additional 320 facilities are currently being upgraded. They haven't been completed, but they are now in the process of being upgraded. And states have taken additional 2,600 facilities to upgrade using impact funds. That is part of this sector-wide resource. And the Project Hope, which is an IDA complemented by several grants resources, is providing incentives to the states to upgrade additional 2,000 facilities. So all in all, we have visibility to how those 4,600 facilities will be upgraded. Now, more than 8,000 facilities have been receiving direct facility financing through the Basic Healthcare Provision Fund in all the 36 states. We have had several Ministerial Oversight Committee meetings where the disbursement decisions were made. And on the Vulnerable Groups Fund, the resources have also been channeled to provide enrollment. And I think at least 600,000 to 700,000 new lives were enrolled through VGF. And overall, health insurance, according to NHIA, more than 2 million Nigerians have been added in the last 1 year. And the point that I also made is that in the last 20 years, if we had been adding 2 million Nigerians per year, we should have 40 million Nigerians. The fact that we've been adding at a much, much slower rate, this is the first year where we had a bump in the number of Nigerians. So we've taken off, but we're not yet at the cruising altitude. But the key issue is whether to revitalize, whether to enroll. Somebody has to pay the premium.
Professor Opate revealed that the number of Nigerians covered by health insurance had increased by 14% in 2024, with an additional 2 million people now insured, bringing the total to 8 million lives. He emphasized the importance of the steady growth, noting that with consistent efforts, Nigeria could have 40 million insured citizens if 2 million people were enrolled annually since the scheme's inception in 2005.
Under government leadership to achieve a change for the people within Nigeria. And it's just really to say that as partners, I think we've been clear at this throughout, that we are 100% behind the vision of the leadership within Nigeria, and we will be putting our weight and our resources behind that vision. So thank you. The Permanent Secretary, entire health sector to putting Nigeria on the universal health coverage trajectory. Greetings from our chair, Chief Mojibo Kadiola, who is unavoidably absent. Honorable Minister, sir, the Civil Society Committee actually is concerned by historical slow progress of universal coverage in Nigeria, where we are consistently, in terms of coverage of health insurance, below 10% irrespective of the measurement. But we are convinced that with the existing policy instrument, in terms of a sector-wide approach, compact and other very good initiative of the Honorable Minister and the entire leadership, we are convinced that they are capable of accelerating Nigerian UAC quest, and we are committed to supporting such initiative. Honorable Minister, sir, we would like to request that we are a bit more intentional about deploying such a policy instrument to expand the health insurance coverage in Nigeria, because we have the potential, we have what it takes to actually have a coverage of at least 50%, and a lot of analysis have been done in terms of without the existing resources, the Honorable Minister. So on the part of the Nigerian UAC Forum, in terms of our contribution, tomorrow we'll be commemorating UAC Day with a roundtable, and part of what we are doing is to inaugurate a couple of committees. One is a committee on innovative financing, which will, and we are acting on the instruction of the Honorable Minister that the non-state actors will go and take the lead. Thank you very much.
2023, and 12 months have gone by, and the kickoff of the reform, I think by all accounts, has been successful. One can safely say that Nigeria's health reforms has taken off, but we are not yet at cruising altitude. So the plane is going up, but we are not yet at the cruising altitude. So as we celebrate this day, knowing fully well that it's on the government, but with the support of the House and everyone else, that we will get to the cruising altitude and Nigeria will be on its path to universal health coverage. We outlined in the last year and a half under the leadership of this president an ambitious agenda which acknowledged the challenges that Nigeria had in terms of financing of its health. Universal health coverage is not free. It's not cheap. Good quality health is not cheap. It has to be invested upon. And health is an investment. For every dollar that we invest in health, there is a multiple dividend in economic development. We also acknowledge the structural limitations, the fragmentation, efficiencies, but we collectively made the decision to come together, federal government, state governments, all the 36 state governors, local governments, our development partners, and agreed on a compact that we will reorient our system to achieve better health for all Nigerians, to save lives, reduce physical and financial pain, produce health, and to do it for all Nigerians. By that singular action, by organizing the governance of the sector, I think we started a movement, which I think is beginning to show some very important results. I will not read a very long speech, but I will say, as we have started to take off, we're beginning to see signs that, in fact, there are tangible progress. So, in the last 1 year, from the time we signed the compact and now, what NHI is saying is that we've added 2 million Nigerians on health insurance. There's 700,000 people. Now, this is just in 1 year. Now, if Nigeria had been adding 2 million for the last 20 years, we would be at 40 million today. So the pace at which we are now adding is actually dramatically shifted. And that is financial protection. But that has to be backed by revenue. That is tax revenue, government revenue. The primary healthcare expansion, at least 238 have been completed, about 300 are on the way. There are 2,000 that are being done by the states, and Project Hope will do another 2,000. So 4,000 revitalization. That is tax and revenue financed expansion of the primary healthcare that will serve pregnant women, that will serve children, that will serve those who are ill. We kicked off the Maternal Mortality Reduction Initiative, MAMI, which is offering free emergency obstetric services, including cesarean section. The empanelment is ongoing, more than 30 facilities, and as of yesterday, I think about 70 of them were going to be signed up, so that we regulate the quality of the services and we have the reimbursement mechanism. Obstetric fistula.
The press briefing was attended by key stakeholders, including representatives from the World Health Organization, Nigeria Universal Health Coverage Forum, and Health Development Partners, FCDO, all of whom lauded the government's progress in advancing UHC and improving healthcare outcomes of Nigerians. Comfort Olayinka, DCTV News.